Hi, I'm Dr. John Preston with the Clinical Psychopharmacology Program at Lang International University in San Francisco. And the bad news is, with mood disorders, most of them are highly recurrent or chronic. With major unipolar depression, 80% of people who have one episode will go on to have subsequent episodes or have deteriorated into chronic depression. Bipolar disorder, by definition, is a disorder of recurrent mood episodes, mania, depression, hypomania. Another thing that's very unfortunate is when people have a recurrence of a mood episode, oftentimes they don't immediately come in and get treatment, either psychotherapy or medication treatment or the combination of the two. It may seem counterintuitive, but a lot of times when people start having their second or maybe their third episode, there's a lot of hopefulness and maybe denial mixed in. Well, maybe it's not going to get bad this time. And people put it off for several weeks, but oftentimes several months, and they just continue to deteriorate in terms of functioning. And in that case, then the mood episodes are tougher to treat. A key to really addressing long-term stability with recurrent mood disorders is to engage in relapse prevention efforts. And that's what I want to talk to you about in this particular show. If I could have the first slide, please. The approach here is to engage a couple. It could be husband and wife, could be partners, could be parents and adolescents, if that's the case. And to have them come in and after their current episode is either resolved or it's much better. And this is a proactive approach where you talk with the two people and say, unfortunately, with bipolar, it is going to recur. And 4 out of 5 people with major depression will experience at least one more relapse. And what we've got to do is nip that in the bud. The first signs of recurrence, if you can jump on it in terms of psychotherapy, exercise also is very good for treating unipolar depression and or medication treatment. We can oftentimes arrest the development of that episode and reduce a significant amount of suffering. And so here's the strategy. It's very proactive, and I'm going to use the example of a man who has just had a major depressive episode and made a very serious suicide attempt, and his wife is with him. Okay, what you want to do is to say, I would like each one of you independently to go out in the waiting room, or you could do it as a homework assignment. Take a tablet of paper and write down any and everything that you remember that might have been an early warning sign of this past episode. If I could have the next slide, please. Now, just asking people to do this in general is not going to yield very much, but you give them these different categories to address, and it'll really help people to remember, hey, actually, a couple of weeks before my husband got depressed, he was not sleeping well, or he started not going to church every Sunday, or wouldn't go bowling with his friends, or, it'll vary from person to person. But remarkably, the same early warning signs tend to recur with each episode within each given individual. And so, in this case, the husband and wife will sit there and think about this, come up with, usually 3 or 4 or 5 things that might have been actually signs of an impending episode. They do it independently because people are going to see things from different perspectives, and then they come back in the therapist's office and you share the results and mutually agree upon maybe 2 or 3 of the particular behavioral changes that both the husband and wife say, well, yeah, that probably was a sign of this episode coming on. And then what you do, you say, okay, now really, me as your therapist, but the two of you working as a team have got to be very proactive and be on the lookout for early signs of recurrence. And here are the symptoms that both of you agree are likely to herald the onset of a new episode. The next step is to have the non-affected person, in this case the wife, come up with a pat phrase that she can come to her husband with when she starts noticing these symptoms cropping up. Sometimes people who have the mood disorder will notice these early warning signs, but oftentimes family members are even more keen to noticing them. And what you want to do here is come up with a very simple, straightforward phrase, sentence, short paragraph to share your concern with your husband in this case. And it would be something along these lines. The person's starting to get depressed, and so woman's getting concerned, and then approaches her husband and says, honey, as we promised to do in psychotherapy, I am coming to you and I'm saying, hey, I'm seeing the following symptoms. and sleep disturbance or loss of appetite, whatever it is. And, and as we agreed to, I am coming to you and saying, I think it's possible that you're starting to go into another episode. And as we discussed and agreed upon in therapy, when we saw that, you promised that either you would get in touch with your therapist or your treating physician, or if you couldn't or wouldn't, that you gave me permission to call them on your behalf. Now, a little aside here, in bipolar disorder, it's going to be important to make separate lists for early warning signs for manias and separate lists for the bipolar depressions. And unfortunately, with depression, it's pessimism that oftentimes rules the day. The person starts getting depressed, and maybe they know it, but say, here we go again. Nothing's going to help. And that may lead to them not seeking out treatment. Or as I said before, maybe wishful thinking that maybe I can snap out of this or something like that. With mania, it's a different story, and that is really early in a manic episode. Judgment and personal insight go out the window. And so a lot of times, the person who's clearly becoming ill with a new manic episode, everyone around them knows that. Says, oh, no, there's nothing wrong with me. I'm okay. And that's why agreeing ahead of time to have the spouse, the loved one, the partner intervene in terms of contacting the therapist is very important. The last thing it's important to do is actually write down verbatim the message that the woman's going to give her husband, and then do some role playing and say, okay, I want you to read this to your husband, and then based on that, based on his take on this, is there anything about this, Mr. Smith, that makes you feel on the defensive? Is there anything about this that feels critical or judgmental? Because what we're going to do, we're going to try to reword this so that it's firm, okay? It's straightforward, but it's compassionate also. It's not about putting somebody down, but it's about coming up with a phrase that is going to be receptive to the person who's experiencing the illness. And so you may want to revise the words a little bit, but come up with a final script. And it's very important to write this down. And the woman, in this case, is going to keep a little index card with these specific words on there to use if, in fact, there's a recurrent episode. And what you want to do at this point then is to role play and have her actually say it to him, and then ask him, how was that? And role play probably 3 times. This may seem redundant or what have you, but it's not. It actually makes it significantly more likely that the person is going to be able to deliver this message when things happen. Now, in this particular case, we said that this gentleman had a serious depression and made a very serious suicide attempt. And it's understandable that spouses, partners, and so forth, when they start to see signs of a recurrent episode, it really scares them. And sometimes they don't know what to do. And if you go, oh, not this again, that kind of reaction is not exactly going to be calm and assuring and that sort of thing for the person who's starting to get depressed. Now, I must say that this time, effort, energy put into developing an early warnings sign list is minimal. You can do this in 30 minutes or less, and yet it's almost never done. And yet the name of the game with mood disorders, unfortunately, is they are recurrent. And nipping them in the bud is a very high-yield strategy to reduce the likelihood of another episode and unnecessary suffering. Thanks for listening.